Hi there, my name is Claire Parry, Integrated Health Practitioner, Registered Nutritionist and Women's Holistic Health Practitioner and founder of the Women's Health Hub. Our mission through the channel is to educate and empower women to take back control of their health through discussing subjects close to my heart and by inviting special guests onto the channel to talk about subjects close to theirs. So without further ado, find a quiet spot, grab yourself a brew and let's get to it. Hello there, so it's Claire here from the Women's Health Hub and it's so lovely to connect with you today, wherever you are and whatever day it is. So today I'm going to talk about the menopause and how to negotiate through this transition in life, which happens to 50% of the population, which are women born with a womb. Menopause can happen naturally and gradually or immediately if medically induced. So what is menopause? The definition for menopause is the point after your final period, the time when your periods cease and your reproductive years are behind you. Most women don't know they've reached menopause because there's no definitive test. But if you've gone without your menstrual period for around 12 months and you're over the age of 50, or for 2 years and you're under the age of 50, you are said to have actually reached your menopause. But until then, many women won't really know that they've reached menopause until that time has lapsed. The time leading up to this timeline can leave women in a state of limbo, knowing that something's changing, but not always sure of what that thing is. We often pass off our symptoms as other things, such as tiredness from overworking, mood swings, maybe stress from work, it's just all piling up. So quite often we look for other things that can explain our symptoms. It's actually menopause or perimenopause. So the menopause is the time when our sex hormones decline and start the transition into menopause. These years are often unpredictable, with some describing this particular time as quite chaotic and confusing. I speak with women in my practice regularly who are quite fearful of this time in life and absolutely dreading it. But I'm here to reassure you that with the right knowledge and tools, the perimenopause and menopause can be a positive time and a rite of passage as we transition out of our childbearing years. So as mentioned previously, there's no universally accepted definition or specific diagnostic criteria for menopause, so it can be quite difficult knowing if these symptoms are the cause of something else going on in your life. And this is why women don't always receive the correct diagnosis or the correct care. Women may be diagnosed with other conditions such as overactive bladder, thyroid problems, chronic fatigue syndrome, mental health problems, high cholesterol, anxiety, with some women being treated for these conditions. So we need to take a step back and look at the bigger picture of all your symptoms together, along with your age and your medical history. With additional information on when you started your periods, how many children you have given birth to, that information can actually give a fuller picture of what's going on for you. And if you don't feel supported, get a second opinion. As there is no standard screening for perimenopause, in part because there's no cure or prevention for what's coming, it's generally down to symptoms. Menopause cannot be avoided. However, we know that many of the symptoms occur as a result of declining levels of estrogen and other sex hormones. Proper screening would not only alleviate symptoms and confusion, but also allow for the implementation of targeted preventative steps. It's true that menopause affects only women who have female reproductive organs, and it's true that menopause is unfortunately often viewed in a condescending manner as a woman's issue. It might not be taken seriously by doctors or within our own culture. As a result, very real-life and health-altering symptoms are dismissed as emotional and psychological in nature, or are categorically dismissed as low mood and should be tolerated or put up with. Women are also more likely to wait longer to be seen and get less time to address their issues than male patients. So this is why it's important that we are educated on menopause so that we can empower ourselves and find the right way forward for us, whether that's a hormone replacement therapy or through natural methods, because there are help and options out there. And while some healthcare professionals do still have a very lack of understanding in this area, and very little training in the menopause, it is important to ask for a second opinion if you feel you're not getting the help and support that you deserve. Sometimes we have to take matters into our own hands in order to get the correct care, because it's said that 90% of women will approach their doctor with questions on how to cope with symptoms related to menopause. Many will walk away from their appointment without a diagnosis or suggested approach to feeling better. They will then seek out resources online or elsewhere to offer some clarity. What I'm hoping to achieve within this podcast today is just to set out some clarity around this transition and hopefully let people gain a deeper understanding of what is happening to their body. A woman's menopausal journey is made up of 3 distinct medical stages: the perimenopause, the menopause, and postmenopause. By definition, these are very different stages, but in terms of experience, they can feel very much the same. The reason symptoms can be similar throughout the stages of menopause is that they're all caused by a deprivation of sex hormones, estrogen, testosterone, progesterone, and DHEA. The decline and eventual end of ovarian function, which is usually the severity of symptoms, not the actual symptoms themselves, is what causes the perimenopause transition into menopause and then on to postmenopause. The average age of menopause is around 52 years old, and it takes, on average, nearly 7.5 years to go through perimenopause and reach menopause. When MIDI Health, a telehealth company focused on providing menopausal care, polled their 22,000 members, the top 5 symptoms were weight gain, body composition changes, brain fog, memory issues, anxiety, depression, sleep disruption, and hot flashes. Many women also report acid reflux, acne, alcohol intolerance changes, anxiety, joint pain, arthritis, asthma, autoimmune disease, bloating, body changes, body odour, body fog, breast tenderness, brittle nails, burning sensation in the mouth, chronic fatigue syndrome, chronic skin sensations, a decrease in the desire for sex, dental problems, depression, difficulty concentrating, dizzy spells, dry or itchy eyes, a dry mouth, dry skin, eczema, electric shock fatigue, fibromyalgia, frozen shoulders, gyno or urinary problems, headaches, heart palpitations, high cholesterol, high triglycerides, hot flashes, incontinence, insulin resistance, irritable bowel syndrome, irritability, itchy ears, kidney stones, memory issues, menstrual cycle changes, mental health disorders, migraines, mood changes, muscle aches, night sweats, fatty liver disease, osteoporosis, muscle loss, sleep apnea, sleep disturbances, hair thinning, tingling skin, and tinnitus, temporal jaw disorders, unwanted hair growth, urinary tract infections, vaginal dryness, vertigo, weight gain, and wrinkles. And these are just some of the symptoms that women can experience when we go through the perimenopause. It's absolutely incredible. It really blows my mind looking at that list, and that is not even all of them. So now you can see that with these symptoms, why women might be diagnosed with other medical conditions and treated accordingly, because perimenopause can be a challenging hormonal stage to diagnose. So for that reason, it's important to look at your symptoms overall and the history of how long this has been going on. In a survey of 5,000 women conducted by Newsom Health Research and Education, it was actually found that a third of women waited at least 3 years for their symptoms to be correctly diagnosed as menopause related, and a further 18% visited their doctor 6 times before they got the help they needed. Yes, there are many overlapping symptoms of menopause with other medical diseases, but this isn't a new thing. It's been happening to 50% of the population since the dawn of time, so we need to get on board with this. Surprisingly, women who have never birthed a child are more likely to go into premature early menopause compared with those who haven't, along with those who have had their first menstrual period at the age of 11 or younger. When these factors are combined, that is, someone who has not birthed a child or children and started their period younger than 11 years of age, there is a 5-fold increase in the risk of premature menopause. and a twofold increase in the risk of early menopause compared with women who started their periods aged 12 or older and who had 2 or more children. Interestingly, the number of births may also influence how severe menopausal symptoms are, showing that women with 3 or more births are more likely to have a more extreme menopause compared to those who have birthed less children. Your cycle length can also play a part, as women with a cycle length of less than 26 days may reach menopause close to a year and a half earlier than those with the longest cycle. A further study also shows that the age of menopause and ethnicity carried out in the United States interestingly showed that the Native American and Black woman actually entered menopause first, followed by Hispanic women, white women, and finally Japanese women. Some have theorised that this age difference in this study may be related to a genetic link to menopausal age, but it's difficult to know the exact reason why. So let's chat about the 6 hormones which make up the female reproductive system. Estrogen is what I refer to as the fury hormone. Estrogen is a family of 3 hormones which are called estrone, estradiol and esterol. They are responsible for many things, including the growth and continued development of the reproductive anatomy, which includes your vagina and your uterus. It keeps the tissues full and lubricated. It's also responsible for the development of breast and pubic hair, the menstrual cycle, building up the lining of the uterus every month in preparation for pregnancy, bone development and health, heart health, our mood, and the nurturing of our children. And this is why when we go through menopause, women start doing things for themselves again. Progesterone is what I refer to as the Zen hormone because it keeps our estrogen in check and chilled out. Progesterone, or progestation of a baby, allows for the gestation of a child and protects against cancer. Testosterone is responsible for fueling our sex drive. It also helps with many of our bodily functions. It protects against some cancers and gives us our willpower and physical strength. DHEA is a funny little hormone because it's actually a precursor to our hormonal health. It also protects against cancer, improves memory, improves immune function, lowers body fat, increases muscle mass, protects our brain. It's a precursor to our androgens, which are our sex hormone. And DHEA also helps with the growth and repair of reproductive tissue and is linked to bone mass. Then we've got luteinizing hormone. Luteinizing hormone links with follicle-stimulating hormone. They are often found in higher levels within the bloodstream in women who are approaching menopause. This hormone plays a crucial role in the menstrual cycle and is responsible for the production of sperm in males. It stimulates estrogen and progesterone production from the ovaries and stimulates the corpus luteum where the egg is released. A follicle-stimulating hormone is usually what is tested before the diagnosis of menopause. It starts to rise during the perimenopause in a bid to keep the ovaries ovulating. However, its rise does not follow a gradual pattern. Therefore, there are often significant peaks and troughs, which mean blood tests can often vary, so it's not always that reliable. It is released from the pituitary gland in the brain and peaks prior to ovulation and drops afterwards. It stimulates an egg follicle to grow each month as part of the menstrual cycle. Baseline follicle-stimulating hormone levels will increase as women enter the perimenopause, indicating a decrease in the number of eggs. When eggs decrease, the transition to menopause begins. Follicle-stimulating hormone levels at menopause are consistently elevated. When our hormones are within a normal range, we feel great, our body functions as it should. When hormones are outside the normal range, usually in our 40s, we notice as things start to change. When I carry out women's hormonal health consultations in my practice, I like to explain what happens to our hormones at the start of the perimenopause and as it progresses through to menopause. So I'm going to try and do that now. Okay, so we've got 4 main hormones. I want you to imagine a horizontal line with progesterone running along the top, estrogen underneath, followed by testosterone, and then the bottom line being DHEA. All of these hormones are merrily going along happily. Everything's running smoothly. Progesterone, the Zen hormone, is keeping a lid on estrogen, which is our fury hormone. Now I want you to visualise hitting your early 40s, and progesterone literally falls off a cliff. It nosedives along with testosterone and DHEA, although these two do peter off more gradually. Now what has happened is you are estrogen dominant. Estrogen has switched to being the dominant hormone because progesterone, which was the dominant hormone, has now dropped to very low levels. So now you're in this period where your estrogen is the dominant hormone because progesterone is no longer able to keep a lid on the fury hormone. And so we start to notice things like PMS, hot flashes, night sweats, weight gain, mood swings, brain fog, decreased libido, all of these different things going on, bone loss, sleep dysfunction, and women can feel like they're on a roller coaster. Now, estrogen eventually does drop off when you hit menopause to a much lower level, normally around the early 50s. This is when many of the symptoms you've been struggling with through perimenopause do start to even out because your estrogen levels drop off as well. But this amazing little hormone is actually responsible for over 400 important body functions. So low levels can leave us vulnerable to other conditions such as brittle bones, hair changes, skin changes, and more. As you will have always had estrogen, much more than any other hormone, you will remain estrogen dominant post-menopause because the parameters between the progesterone and the estrogen are much tighter. The symptoms you feel after post-menopause tend to be much less and much more manageable. Now, if you've had a full hysterectomy, you will enter a menopause immediately. And if you've received a partial hysterectomy, your transition will be more gradual if you've kept your ovaries. So, what can we do to help manage these symptoms naturally? And how can you have a happy menopause and a happy perimenopause? Firstly, some women choose to have hormone replacement therapy. This is something which you would discuss with your doctor. HRT falls into synthetic and bioidentical. It's important to research both of these types of medication so that you can decide what is the best fit for your menopause. As a registered nutritionist, I work with women to keep the parameters between estrogen and progesterone as tight as possible by removing hormone stressors such as toxins, alcohol, caffeine, drugs, smoking, environmental toxins, food chemicals, processed foods, trans fats, hormones from cattle, low nutrients, birth control pill, and then I bring in things that support hormonal health such as whole foods, good sleep, good fats, lifestyle changes, some supplementation or herbs and medicinal foods. Please note that this will be an individualised plan and must be under the guidance of a registered professional. We take into account your medication, allergies, genetics. It's always recommended you seek professional guidance before embarking on any changes to ensure that they are right for you. So what easy things can you do to help balance out your hormones? Eat more plants. Organic is best, but if you can't access organic produce, then wash before eating or peel. Sleep well. Get plenty of Zeds. 8 hours is a good baseline. Move more. Keep circulation and lymph moving. Get the hormones moving around your body and the toxins flushed out. Resistant exercise can really show up changes in your bone densities, so get those weights out. Reduce stress. Stress increases cortisol, and this affects our hormone production. So remove as much stress as possible. So there we have it, your overview of the menopause with a few easy to implement ways to help balance out your hormonal health. And I do hope you've enjoyed today's podcast and can take something of value away from it. If you've any questions, if you've any comments, please leave them below. I always love to hear from you, and I look forward to seeing you in the next episode. Have a wonderful day, and bye for now.